I'll start off with a land acknowledgement. So I want to acknowledge that we're in Victoria, on the traditional, ancestral, and unceded territory of the Songhees, Esquimalt, and I'm not sure if I know how to pronounce this, Wasenic people. I may have pronounced that wrong, but just acknowledging that they're here, and I am very blessed that I get to live in this beautiful place on this beautiful land. I am a registered nurse. I am the clinical intake director here at TheraPsils. My name is Natasha Fearnley. I oversee all of the ongoing patient management at TheraPsils, our clinical protocol, the further creation and development that's always going on with that protocol, as well as ensuring that any healthcare practitioners we collaborate are educated on that protocol and how they will collaborate with us to support patients. I feel very lucky that I get to do this work. And I'm really honored that I get to talk about these things that I'm truly unbelievably passionate about. And thank you everyone who's here today and anyone who's watching this recording after. I feel just blessed to be able to answer these questions for everyone.
Thank you so much, Natasha. So let's get started with a couple of the questions left over from last time. And the one I'll ask you first is, what are some of the most common abnormal effects during a session with psilocybin?
Yeah, I'll start off by just clarifying that TheraPsils does not complete the psychedelic psychotherapy for the patients that we support. We have trained practitioners who go through our training. They're working in their own private practice, and we then refer patients to those therapists. I have completed one of the trainings. I'm really lucky, and I have some experience providing therapeutic containers for people. But TheraPsils doesn't do that. Going to this question about psilocybin, I want to start off by just saying, I think this person, when they asked this question about abnormal, what they really probably meant was uncomfortable, challenging, right? Every psychedelic experience is so diverse and so different. And we learn when we're holding space to just accept people with where they're at, no matter what's happening. So abnormal doesn't really apply. It's all abnormal. It's weird. It's psychedelics. We just accept people for where they're at, but there definitely are uncomfortable and challenging experiences, physically and emotionally. So some people have nausea. Some people get perspiration or they get really sweaty. Sometimes your body has tremors. You have a lot of fear and anxiety when you're having these challenging experiences. Those are really common. But what we understand is that those challenging experiences are really where the real learning occurs and where a lot of working through, past experiences or working through lessons occur. And in this safe container that's provided, it's easier for people to experience it without being a bad trip. They just learn more from those uncomfortable or challenging experiences. Mm-hmm.
Wonderful. And I just want to acknowledge something and jump off track a second here, but someone's commented here, recognizing that nurses provide 80 to 90% of the palliative care in this town in Victoria. Mm-hmm. This is obviously something that you're probably communicating with many of the patients that are using psilocybin all the time. This may be a little bit off topic here, but how do you find your conversations are communicating to patients what it might be like to take psilocybin?
Yeah, I think that it depends on who I'm talking to. Some patients are coming to us really informed about the psychedelic psychotherapy process, really experienced. And then there's patients who are not. And I think that psychedelics are really hard to explain. It's really ineffable. But I think that when we start talking to people just in general about their psychological or psychiatric history, their social situations, their spiritual beliefs, they start to understand that this process is about them as a whole human and about them understanding it. And then they start to understand that we're going to refer them to patients or to therapists, and they're going to be supported to investigate that further. And then we talk to them about these challenging experiences that I talked about earlier, about how you're going to have a change in consciousness. You may feel very vulnerable, so you're going to have trust with your therapist. And then you're going to possibly, like I said, have these challenging experiences, but the benefits come out of that. Explaining to them, how they will feel in their mind with the altered state is really difficult. But this building trust and this understanding the container allows them to go into what they don't know, feeling safe to do so. Mm-hmm.
Excellent. And safety is important, which leads us into the next question here. How do you, what precautions might a psychedelic psychotherapist or nurse use in the treatment? So what, precautions or medical equipment is on site or necessary when using psilocybin?
Yeah, so this conversation about what's required to keep patients safe starts way before the actual treatment day. As we bring them through our intake, we're really getting to know each patient on a very detailed individual basis, and then providing guides and a care plan of what that patient needs for their own medical safety. So we have these medical complex patients. Maybe one patient has a history of something cardiac related. So then we're ensuring that we're doing all the background checks, ensuring that's safe. And as we're planning that, we're thinking about what that person needs on their treatment day to ensure they're safe. And so it would be very individual per patient. And I see that as we're bringing these medical complex patients through, I'm really an advocate for having a nurse or some sort of medical professional with the therapist. It's not equipment, but that is something that definitely keeps patients safe. And then we can create a care plan for each patient of what they need. So maybe someone has a history of some respiratory illness. Maybe they have cancer in their lungs. So then we're going to ensure that there's oxygen available during the treatment day and things like that. But it's a collaboration and a process as we go through for each patient of what they need. Maybe they have diabetes and we want to make sure their blood sugar is managed. Sometimes we bring them through the process and there's no real concerns about medical counterindications, so there isn't any medical equipment. Maybe it's just the therapist and we feel like they're physically and mentally safe to be without the equipment. So it's very patient-centered and very specific.
Incredible. Now, one of these questions about the actual treatment, I guess came about from a mention of decreasing external stimuli. And I think in the articles and in some of the reports that were in the news, even showing your journey, there were a couple pictures and you've got, something over your ears and you've got blindfolds on. It looks like you're trying to decrease external stimuli, both audio, visual, physical. What are the best ways and why is this important?
Yeah, I had someone look at the article the other day and ask me, like, why are you wearing eye shades? I don't understand. And I think that it's important to clarify that we're really wanting people, when they're ready, after they've been prepared, to have as much of an internal experience as possible. Like, this is about getting in touch with yourself. And so having those eye shades and those headphones covering allows you to have that inner journey where you're with yourself and you're not being influenced by external stimuli. And good ways to have that inner experience to decrease that stimuli is just all about the setting, ensuring that you're in a safe room, in a safe environment. Usually we try to make the room like visually appealing, zen, calm, low lighting, like you said, headphones, eye shades, blankets, sometimes candlelight, and the patient will always be encouraged to go inward to decrease the stimuli. But also I want to mention that it's up to the patient, it's their journey. So they can decide to remove the eye shades, talk to someone, have external stimuli if that's what they need, because it's patient focused, even though the internal adventure, the internal experience is really where a lot of learning occurs. But learning can occur through talking to your therapist throughout the treatment as well. It's really whatever needs to happen.
Excellent. So it really sounds like you're adapting the treatment to the patient, not forcing, a set way or standard. And
No.
I mean, we're human beings, very complex. That makes sense. A question came in through the chat, a really good one, and I think one that you can answer as in your session you were supported by 2 people. The question is, how do patients feel safe with 2 therapists they don't know? And do you ever include therapists that is already well known to the patient in a session?
Yeah. Okay, so I'll start with, yes, sometimes we do end up having patients being supported by therapists they're already connected to and already trust and already have a relationship with. We want to ensure that whoever's supporting the patient is trained and qualified and can ensure they're doing this safely. But any type of relationship already built and trust already built is ideal. But when we connect them with therapists, if they don't know these therapists already, there is a good amount of time of preparatory meetings in which the whole point is to build trust, is to be able to feel safe with one another. And sometimes the therapy may not go forward if that trust isn't built, right? We don't want to rush it. We want people to feel safe and feel ready and feel supported. That's the goal. So time together and being open and being with someone who understands the process and that you feel safe with is definitely something that happens before treatment days occur.
Yeah, I think back at one of the first patients who was treated, Thomas Hurdle, had a gentleman who had been helping him for quite a while join the therapeutic session, and apparently having him in the room there was incredible, absolutely incredible, because of the amount of trust that he felt for this person who's known for years and years. And I mean, his therapist, Bruce, is also a very trustworthy guy, but obviously, you can only do so much work in a couple of weeks to get to know someone. So having people there is important. And I can even think back to examples where family members have been in the room as well there to support the person going through therapy, and also animals and pets. Like dogs. Again, this is a conversation, and you're working with a person. You're not following a detailed prescription or method that can't be broken from. And maybe to an extent, this is the nice part of the work we're doing, is it's not research, and therefore it's not always limited. You're able to open it up. It's compassionate access. And I'm going to try and jump back and forth to the questions on the paper and the ones that are coming up in the chat, because they're both very good. So this person has a question about financing for psilocybin therapy. Are people going through the intake process generally paying for it privately out of pocket, or is there financial support available to them somehow? How does the matter of finances factor into the intake process? And does someone who cannot afford therapy have options?
Yeah, so the intake process, the first step in the process is a 1 hour or longer intake assessment, education, consultation. And that one is free. And when we go through that intake, we have an opportunity to talk to patients about their financial needs, about what they can afford. And so if patients feel as though they can't afford our one-time intake fee, which is a $400 fee that people pay when their exemption is granted, we immediately waive that fee. So there are options for people. And that $400 fee that patients pay one time, that covers all of the services that TheraPsil provides, from the very first time they reach out to being granted their exemption, to having a referral, to all the advocacy work that Holly helps with. And so I could spend up to 8 hours or more working with each patient. And so we do have this small fee to ensure that we can continue to do the work we do. Honestly, it's not enough. We need more funding. We have a fundraiser going on. We need to be able to ensure that I can continue to support these patients. But again, we don't want to have any patient feel as though they can't go through our process because they feel like they can't financially afford it. So we have options. And when it comes to the actual therapy and how much that costs, we also talk to patients about that during the initial consultation. And patients are referred to therapists who are working in their own private practice. So there's conversations when people are referred about treatment costs and finalizing treatment costs. But during that initial intake, if we identify that someone has some financial concerns, we talk about options for them for finding ways to cover their treatment if their exemption's granted, such as maybe GoFundMes. Maybe they have extended health coverage in which they have benefits that can cover some of the preparation and integration sessions. And then we also are working on our compassionate pricing process. And so we're hoping to finalize a fund in which we can assess someone's financial needs and provide them money to cover their therapy costs towards the therapist, and have a contract between TheraPsil, the therapist, and the patient to support them so that nobody's going without therapy who needs it and wants it because of finances. Yeah, I'm really excited about that process. I think it's going to be really important.
Absolutely, and I just want to make a personal comment on how important I've seen the role of nurses in this work and the work that you're doing. The Section 56 process is something that, anyone could fill out, but without the work that you're doing in intake, and I think the role of nurses, how do people get educated, right? How do we make sure that this is safe for them, and that they're well prepared? It is incredibly important. And so I'll echo that. And I certainly see, to answer one of the questions up here, where do you see the role of registered nurses or types of job that this therapy will create? Obviously there are situations where a therapist and their client can work with psilocybin, but so often, and specifically around, the palliative care side of things, and with other mental health and addictions issues, there are so many nurses working with these patients. So the work you do, and I think the work for nurses, I can confirm it's so important. It is so important. And I'm very happy that as an organization, we are supporting people, even if they can't afford it. And it is important. So thanks, Natasha.
Speaking to finances again, I know I might be preaching to the choir, but it would be really nice if the Western medical model provided some sort of coverage for these people to have this therapy. Like, we pay for people to access MAID if they want it. We pay for people to get physical medical assessments. And I think the Western medical model really needs to realize the economic sense it makes for people to have access to these treatments for their psychological distress, and how that will in turn increase the health of people's physical being and save the medical model from a lot of what it's having to do right now. So it just makes sense for this to be available widely and covered. I think it will save, the health authorities, the government money in the long run.
Absolutely.
Mm-hmm.
How did you, so maybe to a more personal level, how did you make the leap to this side of nursing? It's very unlikely for an RN in Canada today to work with these substances using the normal healthcare setting. How did you get involved in this field as a Canadian nurse?
Mm-hmm. Yeah, my nursing background is in palliative care, dementia care, and facility management. And I really feel like those three things kind of really lined me up to be able to do the role I'm doing today. My understanding of palliative care and end of life obviously applies to everything we're doing at TheraPsil. My understanding of facility management, organizational management, administration, staff, overseeing staff, there's that component. And then the dementia care of just how people in altered states and holding space for people in altered states, it kind of goes across the board often with nurses, even outside of the psychedelic container. And I really learned about my skill for holding space through doing that. And then outside of my nursing career, I was volunteering doing harm reduction at music festivals, like really taking part a lot in all the psychedelic communities around me, university organizations that were doing education, having seminars. I was reading all the books, reading all the research, watching all the videos, networking, going to conferences, and just really being involved in the community of people that are interested in doing this work, along with building my nursing career that kind of led into this opportunity. And so I'm extremely lucky that both of those things that I was doing lined up and brought me here. And yeah, that's my journey to become the clinical intake director at TheraPsil.
Okay. So another question here then is for Canadian RNs who want to work in this, in this field, what are their current options? And if there are none, how do they do work? This person asks, how do I do work outside the system? As there really aren't too many containers to do this work as an RN. So what are your thoughts on that?
Yeah, I think that there's obviously opportunities to kind of do all the things I did to get myself in here, like collaborate with people in psychedelic community, take part in conferences, just like get out there, meet people. But there is research going on and organizations doing research and places you could apply regarding psychedelics. There's ketamine clinics. There's always opportunities for nurses to work in harm reduction, street nursing. There's a lot of psychedelic related harm reduction at events and festivals doing harm reduction. And just in general, as nurses, there's always going to be opportunities and more going forward for patient education. People are going to be asking about these things, and no matter where you are as a nurse, there's an opportunity to be able to educate them and communicate with them about what their options are, what's going on. And just in general, like I mentioned about dementia care, I feel like nurses in general are always holding space for patients, right? You're at the bedside, you're there, and learning about this structured model of holding space regarding psychedelics can translate to holding space for any patient at any time, which is really beautiful. Yeah, and thinking about outside of the Western medical model, TheraPsil doesn't advocate or support for any underground or illegal therapy. But as nurses and the harm reduction approach, you'll probably run into people doing this underground. You'll probably have opportunities to educate. If people find out you're interested in this, they're going to be asking you questions. They're going to be wanting to be supported, and those situations may arise as well.
Fantastic. Are there any issues with your license or regulatory body when you go to renew each year? Are there any things that you fear? What are your thoughts on the college? And I assume it's in BC.
Mm-hmm. Yeah, I think that I'm lucky that I'm in British Columbia. I think from what I've heard, British Columbia is more open than some other provinces. I have put my employer, when I've renewed my license, as TheraPsil. I'm not worried because I am completely doing everything legally and ethically, and I'm within my scope of practice. I haven't approached the regulatory body myself, but I know other people have, and I've heard that they are quietly accepting of this, but not publicly. And I honestly think it would be irresponsible of the college to not support nurses doing this work, because we need to ensure people are safe. And this is going to be part of our role going forward as things shift. And I have been brainstorming lately, dreaming, thinking about how it would be exciting if our regulatory bodies created a nurse certification, psychedelic nurse certification. And I see that, I envision that as something that could occur in the near future. If anyone is related to any universities, any nursing programs who would be interested in collaborating, I would encourage you to just reach out to me. I'm interested in who would be interested in working with our regulatory bodies to get something going for nurses when it comes to education.
Absolutely.
Mm-hmm.
So another one, and this might be a long answer, as I know this is what you do day to day, and it's been growing and changing, and it really is the importance of your role at TheraPsil. Obviously, there are thousands and thousands of Canadians who have reached out and who are seeking access to psilocybin, but we've only been able to help a number of them, and it's not because we don't want to help more. But simply because as we're doing this, we want to make sure that we're supporting the right patients, that they have the right supplies and the right resources, recovery capital, and also that it's safe. So can you tell me a bit about your intake process? What does it look like from the moment that a patient reaches out? Perhaps someone saying, that I meet the qualifications, I'm palliative, I've tried many treatments to help with my end of life distress, and it hasn't worked. And I'm interested in using psilocybin. Can you explain to me what that process looks like?
Yeah, our clinical process is so detailed and so extensive that I can't go into all the details now. I have a 13-page document with check boxes, and we go through that checklist with every patient and ensure they're meeting every step of our process. But a general understanding of it is that they reach out on our website. If anyone has any patients who they think might qualify, you can always send them to our website. And they must be over 19, have a terminal diagnosis or be in remission from a life-threatening diagnosis, that they're interested in psilocybin therapy, have identified a potential supply of psilocybin mushrooms, and their emotional distress has not responded to other treatments. So if they meet that inclusion criteria, they fill out our demographic form on our website, and then I get their information. And if they put that they meet our inclusion criteria, I get them to consign an informed consent form, and then I start with the beginning of our intake process. So it starts with a lengthy intake assessment where we educate them about our processes, about what support we provide, about what Section 56 exemptions are, about psychedelic psychotherapy processes. We go into details about their medical history, their medications, their psychiatric history, social, spiritual history, and their psychedelic use history. And we see whether they meet our inclusion criteria, identify if there's any counterindications, if they feel like a right fit for psilocybin therapy, figure out their financial abilities, and we begin to build connection and trust with them during this first contact, and really start to build a safe container. And I really noticed that patients during this first intake assessment really start to open up and start to kind of understand why we're asking all these questions and the importance of this holistic approach. If we feel like after this intake that there are any flags, anything we're not sure of, we may not continue with the process with them. We may explain to them, like, this is the reasons why we don't feel like we can support you right now, these safety concerns, or this and that, whatever it is. We may review it as a team and go over it together and brainstorm about why we may move forward with them, what other things we require to move forward. And if we decide to move them forward with the process, they then do a second medical assessment with usually their family physician or a physician who supports them. Sometimes they're oncologists. And this physician completes our patient inclusion criteria form, which is a medical assessment checklist based on the Johns Hopkins NYU research. That is a second check to see if there's any counterindications, any issues. And after that form is completed, we may feel like they need a third or fourth medical assessment with a specialist. So we may refer patients to, say, their cardiologist if we have concerns about cardiac abnormalities. We may get a psychiatric evaluation done if we have concerns about psychiatric history. And so there's a lot of medical assessments that go into ensuring that this person is a right fit before we actually help them to apply for their Section 56 exemption. So once they've completed all those assessments, the intake specialist does a final review, ensuring there's nothing that was missed, no counterindications. We then help them to write their letter to Health Canada, and we help them to submit their application. It's submitted with letters of support from each physician who supports them. And we continue to help them to communicate to Health Canada, advocate as we're waiting to hear back. So Health Canada often is asking for clarity on certain things, and we assist the patients in answering those questions, continue to advocate, email Health Canada saying we need a response. And if their Section 56 exemption is granted, so now they have permission from Health Canada to be in possession of psilocybin for therapeutic purposes, we then refer them to a therapy team or a primary therapist who's completed TheraPsil's training. We ensure that they're supported by the most responsible physician for their treatment, ensure that there's medical oversight, ensure that the physician is providing any medication discontinuation or tapering if that's required for them. And then we follow up with what's going on with their treatment progression. So they're connected with the therapy team who's in their own private practice. They're providing the therapy, but the intake team continues to communicate with the therapy teams, communicate with the patient, problem solve if needed, provide support, ensure that all the documentation is occurring for the patients, and just continue to connect with the patients and let them know we're there for them for whatever they need. And I'm really excited because soon we're going to be pulling in the research context to all of these processes. Julia, our research director, is finalizing processes for research and how that will pull into my intake, and we'll have more data collected. So it'll be shifting in that sense. But does that make sense? I think so. That's the main kind of broad understanding of how we bring people through our process.
Absolutely. Mm-hmm. Thank you. So what's happening with the exemptions right now? And really, like, on a personal level, what have you seen change? Obviously, there were a number of exemptions granted back in August 4th of last year. And to date, I believe the number is 31 or 30 exemptions for patients and 20 for healthcare practitioners. It seems like things have slowed down. What are you experiencing, and what have you seen as far as patients waiting on exemptions?
Yeah, historically, we would support patients that met our inclusion criteria. We would have letters of support from their physician. Sometimes there was like a few questions of clarity, but usually it was always within 14 to 21 days We saw that Health Canada would approve these exemptions because TheraPsil has the expertise. We've told Health Canada patients require this, and there wasn't really much delay, and we never had anyone have the answer of no. And to this day, we still haven't anyone had the official answer of no, you don't get an exemption, but we've seen a delay in these responses. In early April, 7 weeks passed, and we had, I think at that point, maybe about 5 patients waiting and no responses. We did see after 7-week period, 2 patients did get their exemptions approved, and they were patients who specifically had a palliative diagnosis and had limited time available to like limited lifespan. But the patients who were in remission never got their exemption. And a lot of those patients who were waiting then are still waiting now. We currently have 15 people who have submitted applications who are waiting. And we've seen that Health Canada has started to ask for a lot more clarity on these applications, things that are frustrating, if I'm being completely honest, to try to follow up on. For example, Health Canada is asking now for a lot of detail regarding prognosis, which is like the expected progression of the disease. Specifically, they're wanting patients' physicians to provide an exact number of like, the patient has this many months to live. And first of all, patients don't want to have to chase their physicians to ask, okay, how long until I die? Right? Physicians feel uncomfortable providing patients these exact details about what the life expectancy is. And so I don't know if this is a tactic from Health Canada to not provide a no, but put off providing a yes answer. And we have helped patients to get these answers from their physician and provide that information, but we're still not really getting anyone with remission having their exemptions granted. And we're really through this, seeing this process, reflecting on, well, I have been reflecting on the power of perspective and how patients, when they first started this process, have got this new sense of hope, this new thing to work towards. And all of a sudden I see them, going to counseling more, meditating more, doing all these things that are helping their self-care and preparing themselves for the psilocybin journey. And then I'm seeing that when patients have to reflect on this prognosis number, when they have to think about the limited life expectancy that they're told is their expected life expectancy, how that hope diminishes and how that's harmful on their perspective and how they're not as motivated to, move forward with their self-care. And so I'm struggling with Health Canada's requirements right now for what they want from patients. And I am considering creating an open letter to Health Canada about why I think these requests for prognosis information is really not a good approach to take. And I don't think if the specialists are saying this is required, I don't think patients should have to clarify that. And we continue to advocate for the 15 patients who are waiting for their exemptions, continue to push forward. Do you have anything else to add when it comes to where we're at, Spencer, with exemptions?
Not really. I think you've said it pretty well, and listening to you say it, and rightfully so. I think seeing some of the faces on this call and reactions it is a bit disgusting that you would dig so deep into who needs it the most right now, and instead of granting all Canadians the same type of compassionate access and realizing that everyone's suffering and that has a doctor's support. I really do think there's a need for a bit more equality here, because people are suffering, and yeah, it is really difficult to see how hopeful it makes some people, only to get a response saying more or less we have no deadline we have to respond to you by, and making them fight to try and prove that they need access while their peers and other people get access. So I think there is a level here of inequality through this compassionate access, and it is distressing for both the patients, and it's certainly distressing for me on a personal level, because I talk with a lot of these people all the time, and I know you do as well. You're constantly following up with them. So yeah, for everyone listening in on this, Natasha and I speak quite often about how do we speed this up? Why is it that some patients are are getting response in a couple of days, while others who have been off their SSRIs, preparing mentally and physically and with their families, are told that, after 130 days, sorry, we don't need to give you a response. It's a shame. And it's sad to see that happening in Canada, especially after a pandemic, when we've got such a different perspective on life, and on what it means to die with dignity. And to hear the stories of the people who have had amazing experiences must hurt a lot of the people who are told no, because treatment delayed is treatment denied in this country. There's no doubt about that. And 130 days is too long. So it should upset people, and you do an excellent job of advocating for them, Natasha. So thank you for that.
Yeah, I want nothing more than all of them to get access. That's what I need in my life right now. Yeah.
And here's another question that came through here, because I think that there are a couple people that this applies to. Are the exemptions or are the qualifications for this that you must have a terminal illness, or that you must have had? Have we supported any exemptions, or are there other people seeking exemptions for PTSD or anxiety or cluster headaches? What other things are people trying to seek access to psilocybin for?
Yeah, I have a lot of people reaching out every day for other diagnoses, such as PTSD, anxiety, depression. And we want to support these people. We want to bring them through. But when it comes to patient safety, we have to just take on what we can right now and use that as a push to advocate for this. We really want to ensure that Health Canada knows that people with other diagnoses other than end of life want and need access to this treatment as well. And so we do have some patients who haven't applied for Section 56 exemptions, but would like to, who are going to advocate for these other diagnoses moving forward as we advocate for regulation change. Because it's not just people at end of life that need access, but for the safety that we can provide in the container right now, that's who we support.
Excellent. And yeah, I think, in due time, we will flush out this, charter-based right, which is what gave people with cannabis, who needed cannabis, access to cannabis and to medical assistance in dying. It's a continuing conversation and discussion, hopefully not amongst politicians, but instead amongst healthcare providers, doctors, and patients about who might need access to this and why. And I certainly see, what's being treated with psilocybin, stories of the patients who have been treated. A lot of it is about, yes, I may be dying, but the true pain that I'm feeling that's coming up as a result of my end of life diagnosis is about, this thing that happened in my childhood, the trauma. It's about an addiction that I have. It's about the fact that, it's individual for everyone. Trauma is a human condition, and certainly it does help with the end of life diagnosis and distress too, but everyone's got their traumas. So I think with regulations, we will see, hopefully a bit of innovation and expanded criteria as to who can access it.
And with TheraPsil's goal of just providing training to practitioners and broadening the availability of practitioners who are trained and able to do this, we come closer to be able to support more people who need this, right? And so we're working our way to it.
Absolutely, and a good point just came up in here. Especially with medical assistance in dying, I know that the criteria is opening up for medical assistance in dying, and I don't want to be in a Canada where it's easier to access medical assistance in dying than it is to access a mushroom. That doesn't make sense. It's irresponsible and I think immoral as well. So, I think that's what we're fighting for here, and what we're trying to do is make sure that people have access to more options, and specifically ones like psilocybin. So yeah, thanks. I think we're running out of time here. How much time have we got left? I really want to be respectful of Holly. Do you?
Yeah, so
is it going to 12:15?
We have, yeah, 5 minutes left. I'm just kind of scanning through the questions here. There were a couple questions that came through earlier and through the chat, specifically related to training. And we do have Yasmin, our Director of Training and Operations, on the line. So Spencer, do you want to throw these questions out? And Yas, if you're ready to chit chat.
Absolutely. Hey, folks.
Wonderful. Yeah, so would you, I guess I can ask one of the training ones I see on the document here that came in from the folks who were on the last call. Would you offer to train a team of nurses and doctors working in palliative care as a group of their own here on the island or in Vancouver? What sort of training might be available for them?
Yeah, absolutely. I think there's two options of training. There's an intensive, which would look like 1 week of training, and then the experiential session, which will be around 4 to 5 days. That's option one. Or we could bring you through our standard model, which is a 20-week training program. We meet every second week for 2 hours via Zoom. And then there's additional readings that you would go through. So those are the two options of training. I think what we're looking at right now, because our waitlist is so long, there's 800 people on it currently, is our main focus is around patients. So if you have patients that are in desperate need of support, we would love to train your team and we will make it work, because we are a patient focused organization. So it's really all about the patients. And if not, we'll be going down our wait list based on order of sign up and geographic location.
Absolutely. And I would imagine, although it is unfair that, the process in which exemptions are given out to some patients, I think that focusing on specifically in this example, palliative care doctors and nurses is important, because it seems to be where most of the access is given. Is that more or less correct?
That's 100% correct. Yeah, for sure.
Okay. And just to clarify, I'm not sure if you said it, but I see the question here. How long would the training be?
Yeah, so the training program, it really depends on the instructor. Right now, our most standard training is 20 weeks long. You meet every 2 weeks via Zoom. It's an online module, but the experiential sessions will be in person. And then we've got another model that is intensive training, which might be better for a group who is wanting to get trained. And then we meet from 9:30 to 4:30, Monday to Friday, or we could meet over the weekend, depending on the needs of your group. And then we'd meet 2 weeks after for the experiential session, which is 4 to 5 days. So it's really, we're very accommodating, we're very flexible. It's based on the needs of your group.
Okay. Another really good question came in here, and maybe this is even for me, but could also be for Natasha too, is would you recommend or encourage people with PTSD to apply for an exemption, even though their eligibility criteria obviously excludes people unless they are terminal? Will this help with your advocating efforts? To which I would say, yes, if people are already interested in using psilocybin for, I would say, almost any condition, right? It can be PTSD, it can be chronic pain, whatever it is. I think the important thing is we want to make sure we're not soliciting or encouraging people to take psilocybin. Rather, those people that are already interested, making sure that we're showing the government that these people do exist, giving them a voice, and showing that there is substantial demand for this. If they're supported by healthcare practitioners too, even better. So providing clarity and transparency into just the demand for psilocybin in this country is important, and it is also our biggest struggle. Almost knowing in our hearts and seeing how many people are looking for access, but obviously realizing that there's constraints in who those are and how much those people can be public and what they're willing to say. It's difficult, but we've recently conducted some polls and asked people what they think about, say, psilocybin regulations being made, and the results are incredible. 66% of Canadians, after a little bit of education, are saying we need regulations for psilocybin. So it certainly is, putting out that information, making yourself, either as a healthcare practitioner or as a patient or family member of someone who needs access, making sure that you're, tweeting at the minister and bringing this up with the people who are charged with making changes in that country or in our country. And those are our elected officials, right? They're the people who have been given the power through our policy and legislation to make changes. Exactly. Emailing your MP, is a great way to get this done, because unless Canadians speak up, these are non-issues for politicians, right? They focus on what is important that day or that week. So part of what we're doing really is making this an issue, right? Making this an unignorable cause, the same way the amazing and brave patients did with cannabis, the same way Sue Rodriguez did. That's what this is about, is essentially saying, hey, we've got a serious disparity here in Canada with people's access to psilocybin. So
if I could touch on that, Spencer, I
Yeah.
would like to share about what we were talking about this morning, in which anyone who reaches out on our website, who completes our consent form, we keep their information so we know who's reaching out to us and what they're reaching out for. And we have a plan to reach out to all of the Canadians who want access to this, who don't qualify for us to support them because we only have a small team, we can't support everyone, about opportunities for advocacy. So if you know someone who, say, wants this for PTSD, they can fill out our information on our website, and they will be added to our list of patients who are interested in this, who want this. Even though we can't help them now, there may be opportunities for further advocacy or help in the future. So that is an option as well.
Thank you very much, Tash, and that's absolutely correct. Yeah, so we've actually gone over a couple of minutes. So the last thing I'll just mention on this call is, TheraPsil is a nonprofit. We are publicly funded, and we do have a fundraiser open right now, and I've just pasted it in the chat here. So please sign up for our email list, check out our website, and we would love it if you could share this fundraiser. We're looking for, how many? I think 5,000 $20 donations. So all we need to do is send it out to a bunch of Canadians who support this, and even a small donation can go a long way to help support the work that Natasha is doing, to help support the work that Holly's doing in raising these patient voices and making sure that they're heard. So it really is our hope as an organization to make sure that we're doing the work that unfortunately the health authorities or that Health Canada may be neglecting at the moment, and that we're doing it well, we're doing it properly in a clinically sound model. So thank you everyone so much for joining this call, and the people who will watch it and who have been supporting TheraPsil, and even who are just interested in becoming educated. Thank you so much. It really is incredible, and we've done so much, and I hope we can do much more. So thank you so much, and Natasha and Yaz, thank you very much for joining the call as well and sharing your experiences.